Hello, everyone. My name is Madeline Lederer, and my pronouns are she, her. I am a stamp scholar at the University of Pittsburgh, and it is my pleasure to welcome you to this Hesselbein Global Academy Virtual Summit session entitled Leadership in Crisis, Leveraging the Relational Model of Crisis Management. Please note that this session is being recorded. In this session, participants will learn about the relational model of crisis management and how they can use this tool for crisis prevention, crisis preparation, crisis incident management, and post-crisis management. The presenters will share 3 case studies to exemplify how this model works in practice. Participants will leave with a new framework that they can use in their leadership journey as they become more resilient, adaptable, and proactive leaders. Our presenters for this session are Max Polec and Tony Fountain. Max Polec is an alum from the Hesselbein Global Academy class of 2015 and a graduate from the University of Pittsburgh. With over a decade of startup experience, Max observes the intersection of leadership and business. Currently, Max is the founder of Abstract Collective, a full-service studio focused on marketing, design, and strategy to help organizations build their brand and grow. Max is based in Philadelphia, Pennsylvania. Tony is a past mentor of the Hesselbein Global Academy and a retired senior executive and CFO with a global engineering and construction company. He has volunteered as a mentor with the Hesselbein Academy since 2014. In 2015, he founded the nonprofit Support America's Teachers Incorporated. During his career, Tony successfully helped to manage and survive several large mergers and acquisitions, as well as the engagement with various communities on highly controversial large projects. Thank you to Max and Tony for being with us this morning, and let's go ahead and get started.
Thank you, Madeline. Welcome, everyone, and thanks for joining our presentation on leadership in crisis. We will share with you, we will share with you this model, and we realize this will be a very brief introduction to the model, given the amount of time that we have to cover in this presentation. Max is going to cover our first case. I will cover the second case. Max will then look at a third case, and then we'll have a wrap up at the end. Max, do you want to go ahead?
Sure thing. I'm going to skip through the about us just because we had those lovely introductions. I'm going to start with this slide right here, which is the relational model of crisis management. And we chose this because we found that this is a very comprehensive and thorough way of viewing a crisis. It covers everything from what to do to be prepared for a potential upcoming crisis, how you prevent one while you're in the thick of a crisis, what to do to be able to manage it, and then also the reflective piece after the crisis has occurred, moving forward. So we like this because it covers both pre, during, and post-crisis activities, and you could break it up into 4 sections, really, with each having their own kind of key activities attached to it. So again, for crisis preparedness, it's the planning, it's the processes, the systems, manuals, training, simulations, to be able to ask ourselves, what crisis might we incur in the future and how can we be best prepared to be able to succeed and see it through? Then there's also crisis prevention. This is everything from early warning to scanning, issue and risk management, emergency response. If a crisis were to occur, how can you figure out that it's going to happen as quickly, as soon as possible so that you can start acting to try to prevent or mitigate it as early as possible? Then there's also crisis event management. The crisis is happening, you're in it. It's all about how do you recognize that you are in a crisis? How do you put systems and activation response processes in place? And then what are those best practices to actively manage the crisis that you're currently in? And then finally, it's the post-crisis management. It's everything that's looking back. It's recovery. It's the post-crisis issue impact, evaluation, modification. It's really asking yourself, what have we learned? What can we do better? And how can we make sure if a crisis similar to this were to happen again, that we're better prepared for it the next go around? With that, I'll pass it over to Tony to talk a little bit about how crisis management also dovetails into issue management.
Thanks, Max. The planning process is often linked to issue management. The annual business, strategic, and financial planning reviews must consider known issues such as market competition, the stability of the workforce and supply chain, changes in legislation, and importantly today, reliable sources of data. Issues are distinguished from crisis in that issues are much more predictable, there is more time to resolve them, and they have impacts that can be graded from low, moderate, to severe. On the other hand, crises are rarely predictable, they must be resolved quickly, and are usually disruptive and potentially lethal to the organization. You can find more information on this in the 2007 publication, Issue Management and Crisis Management, an integrated nonlinear relational construct done by Tony Jacques. Now, Max, let's cover that first case.
Of course. So like we said at the beginning, we're going to be covering 3 different cases. The first one is a very timely case, and we want to look into how New Zealand's Prime Minister implemented a COVID strategy. And to start with this, obviously COVID-19 is something we're all familiar, and we can look at how a specific country, state, government has covered and reacted to COVID. And with that, we want to dissect a little bit about what the New Zealand Prime Minister did in her response to COVID. So looking at this slide, I wanted to highlight some of the actions that she took and put it into a specific bucket. So when we look at Jacinda Ardern's response, she focused very heavily on some prevention measures, such as focusing on early intervention to try to buy as much time as possible to slow or even try to end the transmission rate of coronavirus. And she focused on things such as rigorous quarantining at the country's borders and investing in expanding COVID-19 testing and contact tracing early on. She also imposed a national lockdown before New Zealand had a single registered case of the virus, again, trying to make sure that what impact COVID might have on her country, on the people that she serves, is mitigated and prevented as much as possible. Obviously, each country went through the coronavirus, so there is this crisis event management piece, and she did an incredible job with hosting frequent Facebook live chats to both be able to manage being informal and personable, but also being informative and answering the big questions that a lot of people had during that time. She also held daily briefings to share updates on COVID and what that meant for New Zealand residents and citizens. And then she also invested very heavily in COVID-19 testing to be able to dramatically decrease the amount of cases and really guide her country through this crisis. So you can see that there is a piece of recognizing that there is a crisis. There is a piece of trying to act very quickly and buy as much time, make sure you have the proper resources. And also, especially in those 2 points around the Facebook live chats and the daily briefings, there's a big communication piece, right? Whenever a country, a business, an organization is going through a crisis, there's a lot of questions that people will have, and being able to share the most up-to-date information, the most up-to-date guidelines is really, really crucial. With that, I want to shift to a discussion question around this case. Are there any other kind of key takeaways that people saw from the New Zealand Prime Minister's COVID strategy that they would want to highlight? And you could do this by either putting something in the chat or letting us unmute you to be able to share a takeaway from that quick case. I'm also seeing that I can't see the chat since I'm sharing. So Tony, if you see anything in the chat, just let me know on this.
Yeah, I haven't seen anything yet, Max.
Okay. Oh, I see one now, and I actually found it. Jake says an acknowledgement of severity, again, being very clear, being very open about how severe the crisis is and what you're doing to try to mitigate or prevent it. Oh, I'm seeing a lot more come in. A sense of urgency, again, acting quickly and trying to do everything you can for safety, immediate response even before cases appeared. I'm loving this. And then doing what she thought was best for the country, even if some of the citizens might have disagreed. And I love that point too. I think a key piece of that was in her communications, if you go back and watch some of the Facebook Lives, it's very human, very personable. And I think she does a very good job at humanizing the crisis and showing that she's also a human being going through the same crisis as the residents. Updating the populace, providing information, which is key. Of course, being able to get information out to those involved, to those impacted is crucial in a crisis. And these are all phenomenal. So thank you everybody for sharing some takeaways in the chat. With that, I'm going to pass it back over to Tony to be able to cover the second of our 3 cases.
Thanks, Max. For our next case, many of you will recall the terrible airline disasters involving the Boeing 737 MAX on October 29th, 2018 in Indonesia, and on March 10th, 2019 in Ethiopia. I'm sorry if I mistakenly said October 29th, 2018, and then the following one on March 10th, 2019. This resulted in the deaths of 346 passengers and crew. The Boeing 737 MAX airliner was grounded worldwide for more than a year and a half between March of 2019 and December 2020. The U.S. Federal Aviation Administration, the FAA, resisted grounding the aircraft until 3 days after the second crash, when it received evidence of accident similarities involving a new stabilizer system known as the Maneuvering Characteristics Augmentation System, or MCAS. This caused the jets to go into unrecoverable dives from very high altitudes. In simplest terms, I want you to think about this. In simplest terms, think about the cruise control in your car. You're driving down the expressway at 65 miles an hour with the cruise control properly set. As you prepare to take the ramp for your exit, you tap on the brake. But instead of the cruise control disengaging, allowing you to slow down to the 35 mile per hour speed, posted speed, your car instead quickly accelerates, speeds up as the exit ramp turns and approaches a street intersection. Boeing's response was very confusing. They had confusing messages where management tried to defend the plane's safety while at the same time apologizing for the crashes. Boeing's CEO apologized in a video 26 days after the second crash, acknowledging that the second preliminary report confirmed that the plane's sensors had misfired in the same way on both doomed jets. So what about crisis preparedness? Boeing felt that they had been prepared for a crisis with plans that allowed them to act quickly in any situation. As for crisis prevention, other pilots reported problems with the MCAS, but were able to recover. With 5 months between the 2 disasters, Boeing obviously had no quick recognition that a crisis was developing. And when the event was upon them, there were various national and international media outlets that were digging into the story daily, and Boeing management could not hardly catch their breath. Post-crisis management, well, beyond trying to prepare for the anticipated millions in settlement claims, Boeing had to convince both the airlines and the public that the updated MCAS software and pilot training would make the 737 MAX safe. So, as a question for discussion, what could be improved by Boeing in handling the 737 MAX autopilot problems? If you care to, you can put your comments or questions in the chat box. Acknowledging their faults sooner, absolutely. And you'll hear that refrain in our presentation. Quickness in the response, quickness. That is one of the first criteria of a good crisis management plan. Do you think the video that CEO presented was the best tool to come out with first? And Alex says, inform the plane's owners, meaning the airlines, about the possible error in the autopilot. Reviewing their crisis preparedness plans because clearly they weren't that prepared. Very good point. And think about the audience for that first message coming from the CEO, that video message. What about the employees of Boeing? Should they have been addressed first? These are things to think about and consider as you move forward with analyzing the problem Boeing had in their labs with the 737 MAX autopilot. So Max, speaking of Max, let's go on to that third case.
All right, right away. So the third case, and this is one that is very well known. It's the 1982 Tylenol Crisis. So I want to start with providing some initial context. Basically, before the crisis in 1982, Tylenol was the most successful over-the-counter product in the United States, with over 100 million people using it. It was responsible for roughly 19% of Johnson & Johnson's corporate profits during the first 3 quarters of 1982. So in short, this was a big seller, making Johnson & Johnson, this corporation, a lot of money. It accounted for a lot of their profit, a lot of their market share. And what happened in the fall of 1982, for reasons that we don't know, is a person or persons, presumably unknown, replaced the Tylenol extra strength capsules with cyanide-laced capsules. They did this, they resealed the package that they opened and deposited those back onto shelves where at least half a dozen or so pharmacies and food stores throughout the Chicago area. The poison capsules were purchased and 7 unexpected people died as a result. And with this, Johnson & Johnson was trying to figure out why Tylenol was making people die all of a sudden with no warning whatsoever, and how to really explain to the world why this big trusted product was suddenly killing people. So that's kind of the context of the setup for this case. Going to the next slide, I want to look into what kind of actions they took, because you have to put yourself in the shoes of Johnson & Johnson here, where they have literally no idea what is causing this, and probably a lot of information asymmetry and a lot of questions on how to best move forward. So with that, analyzing some of their actions, their chairman, James Burke, reacted to negative media coverage by forming a 7-member strategy team. And their guidance was focused on, first, how do we protect the people? And second, how do we save this product? So right away, you can see that they acknowledged that there was a crisis, and they put together a team or a task force focused specifically on figuring out what's going on and how can we do crisis management here. The company's first actions were to immediately alert customers across the nation using media and other marketing types to tell people not to consume any type of Tylenol product. So it was a very big overcorrection, making sure that people were not consuming Tylenol and that they were returning Tylenol appropriately. Also, in the first week of the crisis, Johnson & Johnson established a 1-800 hotline for consumers to call. So this goes back to that communication piece and understanding certain stakeholders, right? There's going to be internal stakeholders, external stakeholders. And when you think of external stakeholders, it's not just the media, but it's also the people that might have been Johnson & Johnson customers before. So establishing a 1-800 hotline so people can call, ask their questions, get information is very helpful on the communication side of things. They also established a toll-free line for news organizations to call and receive pre-taped daily messages with updated statements about the crisis. And the key here is this is daily messages, so that the media can figure out what is the most up-to-date information, what is Johnson & Johnson doing to kind of guide and manage this crisis. Within 6 months after this occurred, Johnson & Johnson started building a new triple safety seal package with a glued box, a plastic seal over the neck of the bottle, and foil seal over the mouth of the bottle. And they started showing this to be able to create a new safety guideline in the industry for a tamper-resistant packaging just 6 months after this. So this goes into that question of how do we prevent a crisis like this from happening again? And how do we make sure that we're taking the lessons from this crisis and thinking smarter moving forward? And then lastly, Johnson & Johnson also developed new random inspection procedures before the shipment of Tylenol to retailers. Again, just trying to make sure that they're doing quality control, quality assurance, and trying to put safety at the center of the lessons learned around this crisis. With that, if y'all can go to the chat, what are some key takeaways from this crisis? What are some things that could be learned and could be used by yourselves in future crises that you might run into? So I'm going to pause there and see what people put into the chat. I see adaptability equals sustainability. That's a very good one, being able to adapt to the situation and be able to take in new information and be able to act accordingly. That's very good. They put their customer safeties first before worrying about any monetary losses or anything. And that's a very good insight as well, because as we all know, Tylenol still is a product that people know and trust. So they really double down on identifying that this is an issue and focus on resolving it, despite what it might lead to their bottom line and implications there. Communication was threaded from beginning to end. Resilience was shown by leaders to solve the problem. Yep, very well said. Leadership took responsibility for the crisis. Yep, and you could see that right away with an immediate response, and also putting a task force whose whole job was focused on figuring out and managing this crisis. Responsibility and ethical business practice. Of course, there's a lot that can be learned from this, especially as we think about businesses and the negative externalities that their products or supply chains or ways of operating might have on people, planet, et cetera. There's commitment, accountability, and desire for positive results. Yep, very well said. They made themselves available to hear the customer's concerns through a hotline. Yep, and that's again a big piece. It's communication. It's figuring out how to get the message, the new information to all the stakeholders that you would want to. And they also found a long-lasting solution, not just a quick way to solve the crisis. Very well said. Again, a lot of it is when a crisis happens, you want to really ask yourself, how can we prevent this same crisis or similar crises to this from ever occurring again? So trying to really look back and say, what can we learn, and then move forward with how can we prevent this from happening again, and how can we prepare if something similar were to occur again? So these are all really incredible takeaways. And I see Tony put one in: leadership, resiliency is key. Yep, very well said. Any other takeaways? This is a very solid list, but I'm just going to pause for another 5 or so seconds to see if there's any other takeaways from the group. Awesome. All right. The last thing I'll say on this is this case is very well known for a reason, because it really helps break down what is kind of a 3-step process to any crisis. And to kind of highlight that quickly before moving it to the next slide and handing it back to Tony, it really comes down to 1, having the top person respond, 2, having the organization take full responsibility, and 3, doing some type of overcorrection, right? Recalling the product, communicating as effectively and efficiently as possible. So those are the 3 big things that people take from this case that they can apply to most crises. It's top person responds, organization takes full responsibility, and overcorrection occurs. With that, I'll pass it back over to Tony.
Okay, thanks, Max. I wanted to highlight that issue of leadership resiliency. If you've ever been in a crisis, you can appreciate the fact that the top person, whether she has command and control, whether she's working in a more collaborative setting with subordinates, that leader has to maintain a certain level of calmness, but yet deliberateness. And I can tell you from personal experience, I was working on a project when 9/11 took place, and I was in Anniston, Alabama. We were working to build a facility to destroy the chemical weapons stockpile. That is a stockpile of rockets, artillery shells, landmines that were loaded with nerve agent, mustard agent, And all of a sudden, the alarm went out over the entire installation that there's been an event in New York and in Washington. And we were in a crisis mode because we had people exposed. Of course, the US military was there to help us, but the commanding officer of that installation took full control, and it put everyone else at ease so that we weren't panicking as far as being exposed to various nerve agents and mustard agents in this time of immediate crisis. So we look at these four phases, primary four phases in this model: crisis preparedness, crisis prevention, and the actual event management. And then very importantly, post-crisis management, trying to find root causes to a problem, trying to prepare for the next crisis, because if you've had one, odds are there's going to be another one, and you want to be best prepared for that. So we have an additional element to put in your leadership toolbox. And I don't know if Max, if you can post this up, the bonus handout, the top 10 considerations.
Let me see if I can get that open on my side right now.
Okay.
Everyone just give us 1 second.
And while he's pulling that up, we talked about, and several of you commented on, the need for immediate response. And in the top 10 considerations, the very first one is the need for speed. As it says in the handout that you're going to receive, crisis can escalate at lightning speed. And it's often in today's world driven by social media. And that's why it's important for anyone who's preparing a crisis management plan, and even in your issue management plan, to consider the impact of the modern technologies, social media. Did we get it up there yet?
Yep, it's
okay.
It's being shared, so everyone should be able to view it as you speak through.
Great. Yeah, so this top 10 considerations was prepared by a consulting organization out of Washington, D.C. called Crisis Management Plan from the Rock Dove Solutions, Inc., and that's the consulting company. And they boiled down these 10 golden rules, if you will, of crisis management, and particularly in the digital age. So I just wanted you to take a look at some of these. We talk about speed, of course, being true to your core values as an organization, being true to your brand, as it says. And they refer to a few case studies so you can put it in context with those various case studies. Understanding the new role of old media. That's a very interesting comment. People no longer care about facts so much as whether the news supports their own beliefs. And we find that dialogue very, very common in today's world. Here's an important one, and this is one that in the Boeing case was paramount, and that is the collaboration between the communications and your legal department. When preparing a crisis management plan versus where you're preparing an issues management plan, you want to have tight coordination and collaboration with your legal counsel. You don't want to get out front and say something that could ultimately lead to further challenges with the post-event response. For example, say the wrong thing and your lawsuits will multiply geometrically.
Yeah.
Employees are one of your most important audiences. And this is why I mentioned earlier in the case with Boeing, who should the CEO address first? And this is an interesting question because in the case of the airline crashes, no one really knows what caused the crash until much later on. And do you respond, does Boeing respond to the airlines? That's their customer. Do they respond to the public? Do they respond to the employees? And whether you decide which one goes first, never forget your employees or the members of your organization. Some companies have found that during crisis, and then I think this was true in the case of the Tylenol case, where some of the employees became whistleblowers. This was also true in the Boeing case. So the employees maybe, and I'm not sure if this is true, but maybe they felt that they needed to come forth because management wasn't communicating to them. I was just looking at one of the comments here, triage. Ask yourself, what is immediate, important, and routine? Nicely stated, Stacy. And then Joshua's comment on the resiliency, dedication, and being considerate. He or she is more likely to get a problem or crisis solved within a shorter period of time in the best interest of all parties involved, like that. And back to our 10 criteria, empower the crisis team with digital tools and resources. Social media is a two-way process during the crisis. I can say from experience, I never had to deal with a crisis with the kind of social media that we have out there today. And that would definitely present a whole set of unique challenges. I see here great advice from an Air Force veteran, first responder, and teacher friend of mine, triage, yes, yes. Data and analytics can prevent a crisis. I mentioned that one of the things that has to be considered in your crisis management planning, as well as issue management planning, is the availability of accurate data. Now, I say that and you say, well, that should be a given. But in today's world, with the increased incidence of hacking, how reliable is that data? Particularly, how reliable will that data be in a crisis? And how can you prepare for it and prevent an issue of hacking that could impact your crisis management? Max, I'm going to ask if you could just go over the last 3 of these 10.
Of course, of course. Looking at number 8, brands must anticipate social, cultural, and political issues. There's greater expectations nowadays for brands to stand for something, and we also live in an age that can be quite polarizing based on whether this is politics or social media. So again, just understanding and trying to work within the full context of culture and stakeholders when figuring out the best way to act and to move forward during a crisis. Number 9, the soundbite is even more important. Some people like to argue that since a lot of content has been shortened, whether that's on short video, short audio clips being used in public and in media, it's never more important. It's never been more important to be able to capture your story concisely in a compelling way, be able to very clearly say, this is the issue, this is what we're doing, and this is our plan moving forward to be able to resolve this crisis. Communication is something that you've heard both Tony and I say a lot during this presentation, but it really is a critical component of any crisis that one would have to manage and try to turn around. And then last but not least, have an up-to-date crisis plan. I love the points that Tony mentioned around data and analytics, right? Making sure that you're getting the right data, but also making sure that that data isn't outdated. So you want to make sure that you're collecting the right things in a regular manner, because that could yield itself to things that might help prevent or prepare you for a crisis, such as early warning signals and stuff like that. So always be trying to make sure that your crisis plan is up to date, particularly for all of the 9 reasons before, because the crises are complex. There's a lot of moving pieces, and you really want to be as prepared as possible. And one of the big goals of this presentation that Tony and I did was trying to equip everybody with as many different examples through case studies and as many different tools and skills as possible, so that everybody tuning in can take something away from this conversation, away from this workshop, having learned something, tying it to crisis management, prevention, et cetera, et cetera. I'm also going to look really quickly at the chats. I see Phil said, I think every leader needs to learn to manage crisis by learning social media damage control. Again, that is a very key point, because the way that we communicate is constantly shifting and evolving. So being able to understand that is key. And yes, I agree with what Stacy said. Social media is a whole other thing in and of itself. I'm looking at another comment as well. In this process, trust is foundational. Trust is very foundational. Being able to have a high believability and being able to solve, and that you have the right intentions, is key. Again, think back to the Tylenol case, how this happened back in the 80s, but Tylenol is still a prescription over-the-counter drug that's used today. The leader in its team is working in a vortex for realizing the best results in a specific time over and over. Optimizing talent, ensuring that's cool. That's really crucial. Ensuring you have the right people on the team, on the action force, disciplines such as commitment, courage, humility, discipline, play out over and over again. Communication intelligence, communication planning. This is all very well said from Harris in the chat. With that, I'm going to bounce back to.
Hey, Max, just one point. I don't know if on your screen, I think a gentleman named Raymond had raised his hand. I don't know if you saw that.
Yes, I can see that now.
Max, can you hear me?
Yes.
Good morning, gentlemen. Thank you for doing this. As you were presenting this, it occurred to me that the circumstances we are in today, are we in a crisis, or are we responding to issues? Many crises dissipate on their own. They come in cycles. The business or the entity may die as a result of the crisis, or it may thrive and move through it. We're in one now where it's really unknown. And I was imagining being a CEO of a company, today, or even New Zealand, being the Prime Minister of New Zealand. What am I doing now? Because the next round, if it does happen, I'm not trying to be a fatalist here, what do you prepare for? What if the government doesn't bail out like it could? What if it doesn't have the capacity to bail out? Even when we went into this, we didn't know that the government would bail out. I certainly didn't know the government would bail out to the extent it was able to. So it's a very interesting topic, very timely. I'll shut up and see if you have a comment.
No worries at all. And thank you for that thought and that question. It's really hard to answer that question of, how do we know what to prepare for looking forward? And I think that is where things like strategic planning and also decision trees come into play, right? It's what are the risks that we might be able to incur, and how can we work now to be able to try to prevent them as much as possible. So I think it's part decision tree. I think it's part decision tree, part strategic analysis, and also a risk assessment to be able to see for your organization, for your business, what might be a potential issue or crisis that can occur, and how are you best prepared for that. And that could be on a big level, but that can also be on a small level. And a quick example I would give on a smaller level that I'll share is when I was actually back in university, I worked at a bank one summer, and everything is run on the computers, everything's run over Wi-Fi, but I wouldn't necessarily call this a crisis, but an issue that could happen is what happens if the bank's Wi-Fi is out? How do you serve your customers, and how do you operate a bank without technology, or without power, or without Wi-Fi? And the bank actually did a really good job of not only having a binder with the entire process lined out, but also having that as part of its employee onboarding. So again, it's really looking into what risks might be incurred that could turn into issues, can turn into crises, and how can we do the brain work now to be able to strategize accordingly before they happen, and be as proactive as possible. So I'll pause there and see if Tony has anything to add on that.
Oh, yes, I do. And thanks, Jessica, for your comment about possibly working in different parts of our model diagram at the same time, because that very clearly relates to one of the publications that I referenced earlier on issue management and crisis management, an integrated nonlinear relational construct. And so, what Jessica is pointing out, and I think very correctly, that there are times during a crisis where you're both in the crisis event management and you're also in crisis preparedness mode. And so these things can be happening in a nonlinear construct. You can be in different parts of this model at the same time. You may also have someone in your organization already preparing for the post-event management. But I wanted to also get back to the comment Raymond made earlier, as far as, are we in a situation of managing crisis now or issues? And I would say in particular with reference to this pandemic. And I think we're in both. I think we're trying to deal with issues as well as crises. And remember now, issues are things that you can predict more and that you can have more time to prepare. So just the campaign to get out the already prepared and manufactured vaccines, that allows you more time and to adapt to different situations. Remember, the initial vaccine inoculations were done on a large scale, large scale auditoriums and arenas and things like that, and health centers. And then they started to scale down as time went on to the local pharmacy. So these are, important considerations that at various times you're going to be dealing with both immediate actions required as well as more time to prepare. And one other point that I would make, again, from experience, now that we've gone through this pandemic or are going through this pandemic, we can be preparing now, both locally, nationally, and of course, worldwide, for the next one. Because these things do come kind of in cycles. But on a smaller scale, I've had experience working with EOCs or emergency operation centers where you plan for a crisis and emergency. And what you often will have is periodic tabletop exercises or full-scale kind of models of going through the crisis management plan. So you practice this with your team. So you're prepared for the next one, okay? We
Very
have
well
just
said.
another couple of minutes. Max, you wanna add any more comments, or are there any other chat room
Yep.
comments?
I put something in the chat. We only have about 2-3 minutes left. So if people would like to add into the chat any takeaways or any questions that they want to highlight before we wrap up in the next few minutes. And I loved what Harris said, and I specifically want to hone in on, we prepare for the unknown to be at our highest performance levels given any factor. And I think that reminds me of a quote or a saying. It's what is it called? It's bleed in training, not in war. And it's basically making sure that you are coming up with protocols, training, so that when it comes to a crisis, when it comes to an issue, your team is more than prepared to be able to steward through that and to be able to manage that. So that's a very good insight coming from the professional athlete world as well. Oh, thank you for the compliment. Great presentation. Any other takeaways that the group has from these presentations, or any other ideas that they want to share very quickly in the chat? We have about a minute before we close it up. I see a question from Stacy. There is a link to the 10 examples and case studies in the presentation. I know the video is being recorded, but we'll also try to make sure that both the slide deck presentation along with the Google Doc is shared with everybody. I'm going to pass it back over to Madeline to close things out. Thank you, everybody, so much for tuning in.
Thank you. Thank you very much.
All right, thank you. We want to thank Max and Tony for their presentation this morning. Thank you as well to all of the participants who have joined us. At the conclusion of the summit, you will receive an email with a link to a survey. We ask that you please complete the survey at your earliest convenience to share some feedback about your learning experience today. At this time, we encourage you to transition to your next session using the Zoom links, which are located in the Summit program. The next session will begin at 11 a.m. Thank you again. At noon, sorry, not at 11 a.m. Thank you again and have a great rest of your day.
Bye, everybody.
Bye-bye.